Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. We're going to talk a lot today about immunization, vaccination, and of course reproductive health care. Before we address those items, down below in the YouTube description box, you'll see a link for the Healthcare Advocacy newsletter. You can subscribe to that for free, and it is the text for today's video. In there will be links to all of the studies, all of the news articles, all of the actions, everything I mentioned is in there. Okay, let's get started. Before we go too far, there's been a lot of talk about krill oil for osteoarthritis. Does it work? Well, the long and the short of it is no, it doesn't work. It doesn't improve osteoarthritis at all. This week, a study was published in the Journal of the American Medical Association. They wanted to know, the researchers wanted to know, in people with osteoarthritis in their knees who have significant knee pain and effusion synovitis, I think that's like a lack of fluid in the knee area. When that was present on an MRI, does krill oil supplementation compare, how does it compare with a placebo, and does it improve the knee pain? The findings in the randomized trial included 262 adults compared with placebo, 2 grams a day of krill oil supplementation, that's actually quite a lot, did not improve knee pain as measured on a visual analog scale. The details are in the newsletter. The answer found: the study does not support krill oil supplementation at 2 grams a day for improving knee pain. It don't work. I'll tell you what my wife finds works is, I think it's called Valerian, which is an NSAID. You just rub it on your knees. You know, it doesn't cure anything, but it takes the pain away for a while. Give it a shot. All right, let's talk briefly about COVID vaccines and long COVID. Long COVID is a serious problem. It can last for months after the patient has had COVID. In fact, my sister-in-law had it, and I got to tell you, she was coughing for a really long time after having COVID. Anyway, COVID-19 patients vaccinated against the novel coronavirus were far less likely to have symptoms of post-COVID condition, PCC, that's called long COVID, according to a new study in Nature Communications. Of course, there's a link to it in the newsletter, I believe. The study was based on outcomes seen among patients in 8 large healthcare systems in the United States who tested positive for SARS-CoV-2 between March 2021 and February 2022. Let's talk about immunization and measles. This is, I got to tell you, a real shocker, because measles is far more dangerous than people realize, and it is on the rise. Anyway, the Kaiser Family Foundation produced an outstanding report on measles and the tricks that are used to convince parents to not vaccinate their children. We're going to address 4 false and evil tropes in this story. One of the reasons it's important, not just if you have children who are the right age to be vaccinated, but these tropes, this misinformation is what's used publicly by people who choose not to vaccinate for other things and want to convince others not to vaccinate. It is a horrible disinformation campaign. It's not misinformation. This is on purpose disinformation. Anyway, let's talk about measles. Measles is on the rise again in the United States. In the first quarter of this year, the number of cases was about 17 times what it was on average during the same period in each of the previous 4 years, according to the CDC. Half of the people infected, mainly children, were hospitalized. If that doesn't make you sit up and take notice, I don't know what will. This is only going to get worse as the number of unvaccinated people grows. Now, many parents have been influenced by a flood of misinformation or disinformation, spouted by politicians, podcast hosts, influential figures on television and social media. And these personalities repeat decades-old notions that erode confidence in the established science backing routine childhood vaccinations. Here's the first one, the no big deal trope. A common distortion is that vaccines aren't necessary because the diseases that they're designed to prevent are not dangerous, or they're too rare to be of concern. Cynics accuse public health officials and the media of fear-mongering about measles, even as it's been reported already in 19 states in the US. Now, measles kills roughly 2 out of every 1,000 people infected, children infected, according to the CDC. Hold that thought, 2 out of 1,000 die. If that seems like a bearable risk, it's worth pointing out that a far larger portion of children with measles will require hospitalization for pneumonia and other serious complications. For every 10 measles cases, 1 child with the disease gets an ear infection that can lead to permanent hearing loss. Does that sound like a bearable risk? I don't know. Another strange effect is that the measles virus can actually destroy a person's existing immunity, meaning that over their lifetime, they're going to have a very hard time recovering from things like influenza and other common ailments that they would normally be able to fight off. Measles vaccines have averted the deaths of about 94 million people, mainly children, over the last 50 years, according to an April analysis of 2024 led by the World Health Organization. So that's one trope. Here's another, the you never know trope. Since the earliest days of vaccines, a contingent of the public has considered them bad because they're unnatural as compared with nature's bounty of infections and plague. Bad has been redefined over the decades. There are some links so you can find those of what bad means in the newsletter. In the 1800s, vaccine skeptics claimed that smallpox vaccines caused people to sprout horns and behave like beasts. More recently, they blame vaccines for ailments ranging from attention deficit hyperactivity disorder to autism to immune system disruption. Good news, studies don't back those assertions at all. However, skeptics argue that their claims are valid because vaccines haven't been adequately tested. This is also false. One medical professional actually pointed out to me that autism typically presents in children somewhere around 2 to 3. It's actually related to brain development. That's why it pops up then. Amazingly enough, that's about the same time children start getting vaccines, and so parents correlate, but there is no correlation. Actually, let me point out what I meant to say. There is no causation. Correlation means 2 things are coincidental. Causation means one causes the other. Here is my favorite correlation is not causation argument, and you guys can share this frequently. Every mass murderer grew up drinking milk. That doesn't mean that drinking milk makes you a mass murderer. Vaccines are among the most studied medical interventions ever. Over the past century, massive studies and clinical trials have tested vaccines during development and after widespread use. It's important to do both. More than 12,000 people took part in the clinical trials of the most recent vaccine approved to prevent measles, mumps, and rubella. Such large numbers allow researchers to detect rare risks, which are a major concern because vaccines are given to millions of healthy people. So you've got to make sure that you're not doing damage as well. To assess the long-term risks, researchers sift through reams of data for signals of harm. For example, a Danish group analyzed a database of more than 657,000 children and found that those who had been vaccinated against measles as babies were no more likely to be diagnosed with autism than those who were not vaccinated. In another study, researchers analyzed records from 805 100,000 children born between 1990 and 2001 and found no evidence to back a concern that multiple vaccinations might impair children's immune systems. I'll point out to you there are links to those studies in the newsletter. Here's another trope: too much too soon. Several best-selling vaccine books on Amazon promote the risky idea that parents should skip or delay their children's vaccines. All vaccines on the CDC schedule might not be right for all children at all times, wrote Paul Thomas in his best-selling book, The Vaccine-Friendly Plan. Let me put this in caps and bold for you. Not true. Don't believe him. And good news, his medical license in Oregon is under a temporary suspension. You can't trust this guy. P.S. Not following the CDC schedule can also be a problem. There's a reason they have a schedule for when to give the vaccines. If you delay the measles, mumps, rubella doses until too late, children may actually experience an issue. It could be problematic. Children that get vaccinated with MMR at 10 years old or older have a higher risk of adverse reactions, including seizure or just fatigue. Here's another trope. They don't want you to know. This is conspiracy world on steroids. They're hiding it from you. Claims like they don't want you to know aren't new amongst the anti-vaccine set, even though the movement has long held an outsized voice. Epidemiologists have conducted more than a dozen studies looking for a link between vaccines and autism, and repeatedly have found none. We have conclusively disproven the theory that vaccines are connected to autism, said Gideon Meyerowitz-Katz, an epidemiologist at the University of Wollongong in Australia. So the public health establishment tends to quickly shut down those conversations, and yet the voices persist. Federal agencies, though, are transparent about seizures, arm pain, and other reactions that vaccines can cause. The government actually has a program to compensate individuals whose injuries are scientifically determined to result from the vaccines. Look, they are not without risk, but the risk is so small compared to the benefit. Remember, I think it was 2 out of every 1,000 children who get measles die. Here's the risk side of the vaccine. 1 to 3.5 out of every million, did you hear that? Million doses of MMR cause a life-threatening allergic reaction. Let me put that in perspective for you, if that 2 out of 1,000 didn't balance it for you. Your lifetime risk of dying by being struck by lightning is 4 times more than the 1 to 3.5 out of a million. Okay, do the math. It is safer to vaccinate. Let's summarize. Vaccinations are statistically safe and effective. Measles, mumps, and rubella is especially safe and effective. Parents have an obligation to protect their children. Do the research, do the math, and then vaccinate them. If there is a child in your sphere, make sure they are up to date on their immunizations. You do it for them, and you do it for all of us. I included a link in the newsletter. I'll put it also in the YouTube description box for you. It is for the CDC's guideline and schedules for vaccinations for children up to the age of 18. Let's talk about something else, but not a happy subject. Abortion rights under attack again in Louisiana. Louisiana lawmakers on Thursday approved legislation making the possession of abortion pills without a prescription a crime punishable by up to 10 years in prison. It now heads to the desk of the GOP governor, Jeff Landry, who has not publicly weighed in on the legislation but is expected to sign it. P.S. Louisiana also has higher than average maternal mortality, extremely high infant mortality, and again, extremely high infant death birth. They don't care. I included a link so you can find that data, in fact, for every state to see how the states do. P.S. The U.S. as a whole doesn't do nearly as well as the industrialized countries in Europe. We are just so far behind them, mostly because we don't have universal health care. Anyway, it doesn't seem that people in Louisiana are particularly anxious to protect anybody's life, either the mom's life or the fetus's life or the baby's life. So let's take an action about this. One of the more difficult parts of advocacy is having to repeat yourself over and over again. It gets tiresome, but we have to do it, and we have to do this with our elected representatives over and over and over again, so they begin to believe that their jobs depend on taking action. Real quick, ResistBot on your cell phone, text SIGN, S-I-G-N, space PUPDJV. That's SIGN, PUPDJV to 50409 to send a message to the president, our senators, our members of Congress. Here's the message. We'll do it real quick. I'm your constituent, and I just found out that Louisiana is going to make possession of abortion medication without a prescription a felony. Stop it. I want you to pass the Women's Health Protection Act and restore women to full citizenship with bodily autonomy by making abortion access a right nationwide. You're either a woman, or you're married to one, or you have a sister or a mom, and lives are at stake, and it's high time our officials acted as if lives were at stake. That's it. That's what I've got for you today. Down below, you can like, share, and subscribe. You can send me comments at healthcareadvocacy1@gmail.com. You can also leave comments here, and I'll get to them and answer. If you have a topic you would like researched, let me know, and I'm happy to do the research for you. That's it. Have a good weekend. Bye-bye.